It's an interesting day. Welcome back to the Amazing Education channel, the Amazing Education station that gives you the information that's going to benefit you. It's what you need to know, and it's not about exciting video. It's just to listen to, because the video can sometimes be very boring. Oh yeah. But I'm a master educator with over 25 years of education experience, including about 17 years of teaching. So although it's not legally legal advice or medical advice, because I'm neither a doctor, a lawyer, nor a financial advisor, I can help you. I've got an IQ usually over 120, and basically it means if you are listening to this, you could benefit. And if you like, thumbs up and subscribe, comment, watch the other videos, and even share them. Things are going to be a lot better. You can look forward to better decisions, better health, a better future. If people followed the advice on my channel, we would have a much more peaceful planet and wouldn't struggle so much. We have to follow human rights and allow people to make their own decisions and avoid the wars and conflicts which could be resolved through the courts and through negotiations and wise planning. Anyway, today's topic is: what can you do when somebody has been diagnosed with a virus? You might know what I'm talking about. It's 2022, spring. There are a number of viruses going around. COVID is still challenging people. And actually, it's in some places, it's gone up in just a few weeks over 100% increase again, and it might be partly due to the relief of the mask mandates, and so they're removing those mandates so you can go around shopping and everything. You don't have to wear a mask. Well, so many people say masks don't help. Well, they don't solve the problem. People can still get sick. But to say they don't help, I mean, when somebody sneezes, most of the sneeze particles are going to hit the mask. And yeah, the mask is then disgusting and would possibly be throwing off the virus, most likely. But it would mean that the many surfaces and many people in the direct blast zone of a sneeze wouldn't get as much. And it really matters how much virus is floating around. And every bit helps. Although, yes, it doesn't prevent the spread. But you know what? If it slows it by 50%, hey, there you go. Even 10%, if that saves hundreds of thousands of people from dying, I think it's worth it. I'd argue that a voluntary mask situation, which exists right now, if people would wear masks, they would save lives if they can just put up with it. Although if they're annoyed and they're vaccinated or in good health, whatever, if they want to risk their own lives, that's fine. But if they have some kind of symptoms, they should have a mask and get tested, stay home, do whatever is necessary. And if they don't have symptoms, at least have a mask available so that you feel a sneeze coming on, you can maybe stop the sneeze or sneeze into your elbow and then put the mask on. Maybe you are getting some illness, and so you just ought to have a mask with you. If you don't think that they're effective, you've got, you have a little bit of reasoning trouble, because think about doctors, surgeons. What do you see in the operating room or on TV when the doctors are doing an operation? They're wearing a mask. Well, why would they do that? Well, to avoid infection, to avoid infecting their patient. It's not that they're, well, yeah, possibly to avoid touching their own mouth with an infected patient as well. But so it works both ways. When you touch your mouth, you can get an illness. We've cut way back on the flu and other diseases by having the mask and by having people stay home in some cases. Now, in case you think I'm for totalitarian situation, lockdowns and so on, well, no, actually, I'm not. I don't think people of healthy situation in certain ages, like maybe, I don't know, age 7 through 40 or something, chance of hospitalization is very low. I don't think those people should have ever been restricted from movement, from going to work, from shopping, or any of that. And I think that it could have actually benefited, as long as somebody didn't live with a vulnerable person, like an older or very young person, or somebody at risk due to, say, diabetes or some other health situation. So as long as those were not the case, I think everybody should have been able to travel freely. And there are places where for months somebody couldn't even go and sit on the beach in public. Can you believe that? It was drastic. But there was a lot we didn't know at the very beginning of the illness. Was this a biological attack? That's still sort of a question. I have to tell you that early on in the pandemic, when I went to a grocery store to buy something, 100% of the time, this is, I'm not trying to start a conspiracy theory here, but 100% of the time, there was an Asian man in the store coughing and spreading illness. Probably. That's right. Yes, you heard me. And I do live in a city that has over a 60% Asian population, I believe. So there's going to be Asian men, and because of the disease that we still have, if they're not serious, then they would be there coughing, and I would walk out. At that time, we didn't really know what things were all about, and somebody coughed directly behind me. I turned around. At least he was wearing his mask, but they shouldn't be in there with symptoms. If you have symptoms, you should get tested. So now, what happens if, say, your workplace, there was somebody that tests positive? If you have had your vaccination or a booster within 2 months for the Johnson & Johnson vaccine, then if it's been 2 months or less since you had the booster, you can still go to work or go to wherever it is, as long as you have a mask. And then within 5 days, day 5, you should be tested for COVID. If it's been Pfizer or Moderna, you can go to work or go out in public if it's been 6 months or less since you had a shot immunization or booster immunization. So 6 months. But you still need to wear a mask and get tested after 5 days. And of course, if you have any symptoms, don't go out in public. Okay, take care now. Health to everybody.